everyone. Just want to talk a little bit about the quiz, give you a little bit of feedback on the quiz from last week, from week one. First of all, happy 4th of July. It's Monday today, but tomorrow's 4th of July, so hopefully you have the opportunity to celebrate a little bit this weekend or celebrate tomorrow if you have tomorrow off. So hopefully folks have the opportunity to do a little bit of celebrating for our nation's birthday. So it's always a good time. Stay safe if you're out there celebrating. No fireworks accidents or other craziness from the 4th of July celebration. So hopefully everyone has some fun. Um, First, just for folks that haven't, I know I've had a few of you that have had this type of review, but I've moved to doing a video review of the feedback for each week. I'll go over the kind of the quiz feedback, quiz question feedback in a video format each week, and you'll also have the opportunity to answer questions in this to show that you've reviewed the quiz feedback. So we'll be doing that each week. I try to get it out on Monday. That's not always possible given what's going on Monday with my schedule and whatnot. So you'll see that pop up on Mondays, and hopefully you'll have the opportunity to do that sometime throughout the week. But always, if you have a question on a quiz, a problem, an issue, and you want feedback more immediate than I can give you through this mechanism, always feel free to call, email, stop by if always call first. I'm not always in the office in Pittsburgh because I do split my time between here in New York and Pittsburgh office, but feel free to email or call, and I'm always happy to go over any issues with any assignment, quiz, written assignment, whichever. But so we'll go over a few of the quiz questions. Generally, people did really well. I do have to warn you that I didn't realize the quizzes were set up for 3 attempts. That's been changed for the future. So don't expect 3 attempts in the future. I was really confused when I saw that people had taken the quiz multiple times. So that's been changed. You will only get one shot at the quiz moving forward. But generally, most people did really well without having to take the quiz multiple times. And even when you did take the quiz multiple times, you'd only missed one or two maybe the first time when you did it. But I did, if you did take the quiz multiple times, I did give you the highest grade that you got on the quiz. So the first question, this is the one probably most people got wrong if they got something wrong, and it had to do with certificate of need. So certificate of need law, or the CON law, is, and the purpose of the CON law, the correct answer is that it prevents excess capacity and duplication of services. And what a certificate of need law and we don't actually currently have one in the state of Pennsylvania, or you don't have one in the state of Pennsylvania. I'm actually not in Pennsylvania, but there is not one in the state of Pennsylvania. The purpose is for people that wish to open additional hospital beds, open a hospital, open an ambulatory surgical center, open some type of a facility of that nature, to have to apply to a state agency, to the State Department of Health, something like that, and prove that there is need for that facility. Now, you may notice, if you say you live in the Pittsburgh region, you may notice a plethora of hospitals. There are a multitude of hospitals for the number of people that live in that area. And I say that it's very apparent to me, hospital beds to the number of people that live there, because I come from a certificate of need state where there are not as many hospital beds to the number of people in an area, because the state of New York governs how many hospital beds there are allotted based on the number of people in the area. So New York State is a certificate of need state, and it prevents excess capacity. So there aren't ambulatory surgical centers on every corner. There aren't a multitude of hospitals. There just aren't those kinds of things. So it's much more governed in a certificate of need state. Pennsylvania used to be one at one point. They sunsetted the law, and then they're trying to bring it back. And but at this point, there is not it is not a certificate of need state. So there is in the Intro to Healthcare Law um, reading. It was a fairly lengthy reading. On page 18, there's some detail on the Certificate of Need law, but there's also an entire kind of little packet of readings on Certificate of Need law in your readings from week one about the kind of the whole. We had Certificate of Need in Pennsylvania, and then we didn't, etc. But it's an interesting concept. It was there, then it wasn't there, uh, but at this point it is not. But the purpose is to prevent that excess capacity, to stop any Joe Schmo from opening up a hospital or an AmSurg center on the corner. Next question. Department of Health is a state enforcement agency that is responsible for the licensure, certification, and approval of healthcare providers. So that's true. We want the Department of Health to be responsible for that act. They license, certify, approve healthcare providers. That again was detailed in that Intro to Healthcare Law section. Now, I will give you it. I actually only see that one person got that wrong, and if the one person that got that wrong wants to approach me with their rationale as to why they answered that incorrectly, I may give you credit for that, depending on your rationale. In some states, like for example, in the state where I live, I may answer that slightly differently. But from our reading, that was the correct answer. That was the answer that would have been proper based on our reading for this week. But so Department of Health, they manage licensure, they manage certification, approval, and what's interesting about licensure generally of healthcare providers. Let's talk about licensure of physicians. So licensure of physicians are licensed state by state. So you may be a physician that has a license in Commonwealth of Pennsylvania, and let's say you've done something that causes you to lose your license in the Commonwealth of Pennsylvania. That doesn't mean that you can't get a license in California or Florida or Alaska, because it's not. It is a state by state thing. So it's state by state. Each state manages the licensure process. So it is managed each state. There are some repositories of information, such as there is the list of excluded individuals and entities. So if you get excluded from the Medicare program because of fraud or abuse, then obviously that's a national database, things like that. But as far as a license to practice medicine, that's a state by state listing, and the states themselves manage that. So it's an interesting way that they approach it. The next question we'll take a look at, the Joint Commission. It's a state enforcement agency that is responsible for administering the laws of the Commonwealth as they pertain to regulation of the insurance industry. So this was false. Joint Commission is not a state enforcement agency. Joint Commission is actually an accrediting body. They are a national accrediting body, and they work across not just in a single state, but across much wider than just one state. And they are actually likely the nation's largest accrediting body for hospitals, but not just hospitals anymore. They are expanding into outpatient services. They do various home care. They do various different types of healthcare accrediting. But Joint Commission is mostly known for their work in the accreditation of the hospital sector. So That actually came from that alphabet soup section of that intro to healthcare reading, that lengthy reading as well. So our answer to that one is false. And then the last question that I wanted to review, EMTALA. It was the EMTALA question. So EMTALA, which is the Emergency Medical Treatment in Active Labor Act, requires a hospital with an emergency department that participates in the Medicare program to treat all patients who present to the emergency department without regard to ability to pay for the services. What process should the providers follow? So the answers are: must treat the patient until they become stabilized, provide a medical screening exam, can be treated by a nurse, or A and B only. So EMTALA requires that patients be taken in to a facility that has, they have to have an emergency department. That's the first requirement. And if they are a facility that participates in Medicare and has an emergency department, the facility has to take the patient in. They have to provide a medical screening exam, and that medical screening exam is not a screening exam that's provided by a nurse. It's not a triage exam, like when you go to the ED and get triage. That's not a medical screening exam. Medical screening exam needs to be provided by a qualified medical professional, which is unfortunately not going to be a nurse. It's going to be likely a physician. So it's going to be a physician, non-physician practitioner, such as a PA or an NP, if that's within their scope of practice in that state. And then if they are having a medical emergency, then they need to be treated until that patient is stabilized. So at the point that they become stabilized, then they could either be discharged if they're stable and they're able to go home, or they could be actually transferred to another facility if that facility chooses not to treat them, or they could continue to have treatment there if they're not ready for discharge. But they don't have to provide treatment. Their EMTALA obligation is met once the patient is stabilized. But so the answer to the question is A and B only. They have to treat the patient until they're stable, and they have to provide a medical screening exam, but they cannot be treated by a nurse only. They do have to meet those other two requirements. But that medical screening exam cannot be provided by a nurse. It does have to be provided by a practitioner, by a qualified medical professional. Okay, so those are our questions for this week. If you have any questions on the questions or on any of the other ones, if you missed one of the other ones and you have a question about it, please let me know. And please check out the answers to the other ones in your readings for the week and see where you may have gone awry. And I'll see you all in the discussion boards this week.